um, get started. Um, Welcome. My name is Michelle Leidenberg. I'm a senior manager of data and learning at Interact for Health. And it is such a pleasure to be here this afternoon with all of you, and to have our friends at Innovation Network here to talk about evaluation and learning. Some of you joined us last year for our Evaluation and Learning 101 webinar, and we are really excited to be able to bring you a 102 session today. Just give us an opportunity to dig in a little further, think about some of the topics with a little more time. So really excited that you're all here. Appreciate you spending the time with us, and really excited to have Corey and Rebecca back. They're so awesome and so knowledgeable. So thank you all. And with that, I'm going to go ahead and pass it over to Corey and Rebecca.
Thanks, Michelle. And obviously we love Interact too, so we'll come back anytime. Um, so hi, my name is Corey Georgopoulos. I use she, her pronouns. I work at Innovation Network as a senior associate. We're a small nonprofit consulting firm that works primarily with other nonprofits and philanthropy to help them with their evaluation and learning work. So a lot of what you're going to see today is drawn on our experience working with a lot of other people and what we've learned along the way. And I'll pass it to Rebecca to introduce herself.
Hi, I'm Rebecca Perlmutter, also Senior Associate at Innovation Network, she, her pronouns as well. And we will share the housekeeping slides are next. Sorry. That if okay, sorry, I thought I was on a delay. I've been having some internet things just pop up, so
No, you're fine.
Okay. If I do drop, I will call back in over the phone. We'll figure this out. But yeah, so we're gonna share the slides and the recording after the session. We would like this to be as interactive as possible. We understand it's a large group of people. So we will ask for comments, questions in the chat. You could raise your hand too if you feel comfortable speaking. We try to build in a little bit of interactive activities throughout the session, but also if you have a question, feel free to put it in the chat and we'll get to it when we can. And then just to, yeah, if you could stay muted when you aren't speaking, that would be great for us.
Cool. Thanks, Rebecca. I will also say, in the interest of making it more interactive, we'd love it if you could just introduce yourselves in the chat if you feel comfortable. So if you could just drop your name, your org, location, whatever else you want to share. Yeah, I'll just put that in the chat too. Cool. So that was housekeeping, and then I just wanted to give a really brief overview of the agenda for today. So we'll be delving deeper into two topics that we kind of touched on a little bit last year. And it's totally fine if you didn't attend last year. We're going to go over some stuff again. And I hope you won't feel lost. We designed it so that even if you didn't see it last year, you'll be fine. So we'll be looking into data collection plans, doing a deep dive on indicators, and then we also reserved a fair amount of time at the end for Q&A. Obviously, please participate throughout, but there is also time at the end if you want to keep your questions for later. It's honestly up to you. We're very open to however you want to participate. Anything you'd add, Rebecca, before we get started?
No, I think that's it.
Cool. Then without further ado, I'll pass it back over to Rebecca for content.
Great. So this first section is going to be about developing a data collection plan. And so a data collection plan is kind of like a roadmap to your evaluative work and your ongoing learning. And it really lays out all the steps that are needed to assess your work. And so it's going to help you think through quite a few different things. The questions that you're answering through your evaluation, the different outcomes that each question is tied to, what potential indicators could be useful to answer this question, where you're obtaining the data to answer the question and how you will collect the data, when the data collection or analysis is happening, who is doing what, and then who is using the data and for what purpose. So it's a lot of things. We have this sort of template that we find useful in terms of the categories that go in there. We're going to sort of walk through the template with an example, and we'll populate it as we go through each section of the plan. But because we both feel like we sort of learn by doing or like following along as well, Corey's going to drop a link to a slide of the template in the chat. And so you should be able to download the template. If you have issues, please let us know. But we're hoping that you could download a copy of the template and think of an example from your own work. So as we're walking through the different steps in the data collection plan, you can sort of practice creating a data collection plan of your own. And so really feel free to fill out the template as we go through each column. We may ask you to share examples if you feel comfortable. And again, let us know in the chat if for some reason you're not able to access the template, and we can figure out another way to get it to you. So in this template, you'll really need to think through the answers to each column before pulling it all together, but the plan provides a way to consolidate all of your thinking in one place and help you move to action. But also, effective data collection plans are dynamic, and so you should feel comfortable updating it if your plans change or your priorities shift. We also think data collection plans can be just a helpful way to be really clear about all the components of your evaluation or your evaluative work, so everyone can be on the same page, and everyone can also see what each part of the evaluation is contributing to. And then lastly, this process is also helpful to do sort of a reality check about if you're trying to collect too much data, or if you're trying to answer too many questions, or even if you're like relying on one person too much for data analysis. So that's sort of like the big picture data collection plan. We were wondering if you all have a formal data collection plan in place in your organization. This could be at any level. It could be like an organizational level data collection plan. It could be at the program level, project level. Feel free to answer in the chat. And so we'll sort of walk, like I said, we're going to sort of walk through the different columns of the plan. The first part of the plan is learning and evaluation questions. And so, you know, the key to this is, you know, figuring out how to focus your evaluation efforts to get the information you need right now to make decisions and communicate impact. And so the way you can focus your measurement and save yourself some time is to create learning and evaluation questions. Oh, and I'm seeing some activity in the chat. Great. Mary, you're working on one now, so hopefully this is like very hands-on session for you. Great, seeing a lot of people have them in place right now. So that's something to think about too as we go through this, is like how this guidance may be able to help you update your plan if you feel like it needs updating, or maybe there's some components of your plan that you know you haven't thought about or aren't in there that are in this template that hopefully could be of help. So the first thing is, you know, you're creating these questions, but let's like step back a little bit and think about how to ask questions that feel achievable to tackle, but are also, you know, actionable, and they're exciting and important to your work. And so a helpful framing is thinking about asking powerful questions. So these are questions that are forward focused and action oriented. We did not come up with this term. Like Corey said, we're pulling together a lot of this from other work we've done with clients, but also there are so many other people out there who are equally informed and cool in evaluation. And so Tanya Beer from the Center for Evaluation Innovation proposed some guidelines for thinking about how to ask powerful questions. And so they are questions that, you know, meet people where there is the most energy around and also relevance for the work that you're doing. They should be forward facing and focused on possibilities for action. So really what you can do to get the results that you want. They should also be appealing to everyone who needs to learn and also include everyone who needs to learn. And they should be genuine. So by answering them, there are things you don't know the answer to already. And then if you do answer these questions, they're going to make a real difference in the work that you're doing because you're able to tie it to strategic choices and decisions that you want to make. And so that's sort of the big framing for questions. And we categorize questions into two types, learning questions and evaluation questions. And so learning questions are really the kind of questions that help connect the evaluation to strategy and decision making. They're sort of the North Star of your evaluative work, and they're forward looking. And so the kind of questions, they usually start with things like, how can we, or what does it take to? And this really keeps it forward focused and action oriented. And some things you can think about when developing learning questions are, what are you interested in learning related to the key areas of work that you would like to answer? Does the question test your theory of change, build your evidence base, or help you be more responsive to changes in context? And then will the question, when answered, help you be more effective in your work? And so that's learning questions. Evaluation questions, these are the questions that your evaluative work or your evaluation is designed to answer. And so while the learning question is sort of like the bigger picture, forward-looking question, under each learning question, you'll have evaluation questions. And so answering them is going to help give you data and insights for the learning question. They're typically more specific and concrete than the learning question, and they're often retrospective. So they often start with things like how or why. And so some things to think about when developing evaluation questions are, you know, once you've developed your learning questions, what topics related to the learning questions are you interested in exploring? What specific supporting questions can help you answer your broader learning question? And so there's sort of, we categorize evaluation questions into two types. There's process questions and outcomes questions. And so a process question is really looking at how a program or intervention is working. And the outcome question really looks at what happened as a result of the program or intervention. And so just want to walk you sort of like a simplified example of how one organization we worked with followed these steps to develop learning and evaluation questions. They also included sort of the purpose, which, you know, it can be helpful to include the purpose of like why you're doing the evaluation, why you're developing these questions. So in this example, they have grants that fund community activism related to health equity, and they are trying to figure out how to best support communities to achieve their vision. So the learning question that they developed was, what will it take to build the capacity of community members so they can effectively advocate to advance health equity within their communities? You also, it can be helpful to sort of think about the assumptions you're making in the questions you're asking, including the assumptions you're making about the change your work is expected to contribute to. So they also included some hypotheses. You know, I won't read them all here, but one was, you know, if we convene community liaisons and provide them with advocacy-focused workshops, then they will be able to share that knowledge with community members. And so then they developed a handful of evaluation questions, including looking at to what extent has the foundation and its partners built advocacy capacity among community members, and a couple other questions as well. And so throughout this process, you'll want to, you know, have some considerations around equity. And so some things to think about when you're developing evaluation questions is, are there specific equity-focused evaluation questions? So you can think about if you're looking at who is not being served or reached, are there differential impacts on different groups of people? Are you looking at the impact on root causes? Are you also looking at unintended consequences? And so if you feel comfortable doing this, and hopefully you were able to download that template, we're just going to take like a few minutes to like think about a project that you're working on now, or if, you know, some of you already have a data collection plan in place, you know, take a few minutes to draft a learning or evaluation question relevant to your work that you're doing right now. We'll pull up the slide again on powerful questions, and then just if you do feel comfortable sharing anything that you have drafted, we will have an opportunity to do that. So just like a minute or two to think about some questions you could ask.
I see, Mary, you're not able to download the slide. Let me download it, and then I think I can maybe drop it in the Zoom chat, and let's see if that works.
Oh, I know this is kind of fast and we're kind of like flying through the content, but maybe you were able to sort of start thinking through some ideas. So if anyone feels comfortable either sharing an example of an evaluation or learning question, or just reflecting on sort of the process of writing one, and what that was like for you, sort of using this kind of guidance. And you can either raise your hand or drop your comments in the chat, whatever you feel comfortable with. Abby, thank you. So you're sharing, to what extent has the eviction prevention program reduced the number of evictions and improved housing stability among participants over the past year? Thank you for sharing that. If you feel comfortable, was there anything like in this guidance that was particularly helpful? Or is this like a question that you have already been sort of like thinking about?
Can you all hear me?
Yeah.
Yeah, I'm on my phone, but viewing on my computer. So I guess in my experience, I've looked at, I've thought about like the end goal or the end result in mind, and then thinking through like what time period the program or the year you're looking at the data. So that's kind of my thought process.
Thank you for sharing. Appreciate it. And we got one more coming in as a learning question. So what will it take to support residents interested in starting a food-based business to be able to sell food in the community? Thank you, Heather, for sharing that. Yeah, so that's sort of like what a forward-looking question about supporting residents. Yeah, I appreciate you sharing that. And you don't have to unmute, but if you want to share anything else in terms of like the process, feel free.
Sure. You hear me?
Yeah.
Okay. So I feel like it was helpful to have this structure of like different types of questions to sort out like what I have been working on and be like, oh, that is that and that is that. So I'm like, okay, this is our learning question. It's what we're trying to do, right? And then I guess the hypothesis is all of the actions that we're taking, trying to get there and finding that answer. And then the evaluation is like our measuring like how many vendors are there? What did they choose to participate in among all of the different things that we put out there available for them? Those kinds of questions are our evaluation questions, I think.
Cool. Thank you. Yeah, this is so helpful, like having these examples from you all and what you're grappling with and focusing on. So I appreciate you sharing. So the next part of the data collection plan is your outcomes. And so the outcomes are really the results that your program or initiative intends to achieve if implemented as planned. And so it's, the changes that occur, the difference that's made for individuals, groups, communities, or systems during or after the initiative, which is different from outputs, which are sort of the direct products or actions of your activities, like number of people trained, whereas an outcome could be something like increased competence of people who went through a training. And so some questions that we find helpful to ask when you're developing outcomes, some things to think about, like what are you ultimately trying to change? For whom? So what individuals, groups, communities, or systems, where, and by when? And then also thinking about what change would most matter to the people impacted by the issue. And so some equity considerations or things to think about when you're developing outcomes. So think about, who does not benefit or who could be harmed by your work. Are there other unintended changes or consequences that might result from the work? And you can also think about how intersecting identities show up or are missing from the outcomes you've developed. And then next is indicators, which again, like Corey is going to go into in a lot more detail later on. But just to share that, indicators, this is, they're a unit of information to measure and communicate about your work or help you track progress toward or achievement of a goal. And so an example in this template, so this first row is one of the evaluation questions was how are we elevating the voices of people with lived experience of our issue? This was the example that we shared at the beginning of the learning question about building the capacity of community members to advance health equity. And so the outcome they developed was that people with lived experience are meaningfully included in decision-making processes. And so one of the indicators they developed related to that is looking at number of people with lived experience who participated in advocacy actions. And so some equity considerations for indicators, which again, we'll go into more detail in the next section on indicators. Just trying to think about, who the indicator is meaningful for, who is defining what is being tracked or establishing what success may look like. And then the next piece of the data collection plan is your data sources. So these are the sources that you'll draw from to collect information about the evaluation questions and the indicators. And so the data sources, they're describing who and where the data will come from. And so identifying the data sources will also help you determine which methods will work best for the data source, which is the next column in this plan. And so, for example, if your data sources are really busy, strapped for time, think about choosing a method that is easy and quick for participants. And so in the example that in this template that we're walking through, the data sources are attendee lists and action participants. So that's looking at gathering information from people with lived experience who participated in advocacy actions, as well as sort of just looking at lists of attendees. And some equity considerations for data sources. Think about using multiple data sources and perspectives, and really think about whose perspectives might be missing, and think about who you'll be collecting data from, as well as their capacity to contribute to the evaluation. And so doing all these things can really help provide a holistic picture of your work and ensure that your data collection is inclusive and representative and reflective of the ecosystem that you're working in. And then also it's a way to sort of think about your own power and privilege and look at, what evidence are you typically collecting from and where, and thinking about, who counts as an expert or a credible purveyor of evidence, and trying to challenge yourself and expand those perspectives. And then the next column is your data collection method. So, you've decided what you want to learn through your evaluation. So now you need to figure out how you'll gather the information you need. And so data collection methods, this is the way the data will be gathered to answer the evaluation questions. And there are many different options for collecting data. Some common options include things like surveys or focus groups or interviews. There are many other methods that we unfortunately will not have time to dive into here. But really what you want to do is, before you choose your method, think about the type of information you want to gather and how you'll analyze that information, and try and match them accordingly. So for the example here, they were wanting to look at the number of people with lived experience participating in advocacy actions. So their collection methods were reviewing attendance lists and also conducting a survey of advocacy action participants. And so for things to think about for equity considerations for your methods, think about using mixed methods, culturally appropriate, trauma-informed participatory methods, that you're really valuing different kinds of evidence, especially the evidence that is valued by communities affected, and be able to articulate the strengths and weaknesses of the different methods. And then also reflect on, the burdens, the risks, the opportunities, and moderate them appropriately so one group isn't bearing undue burden. And then also think about what you know about each group that you're hoping to collect data from and how that may affect how they might engage through your chosen method, and how you can ensure that your data collection is really responsive and accessible. And then the last two columns, they're a little more straightforward. It's timeline and roles. And so the timeline, that's how often you'll collect the data or when you'll collect the data. In this case, they're going to do a quarterly survey. And then the roles column, that really lays out who is responsible for collecting and analyzing the data, but you can also get more specific, like in this example, and include, who's using the data and for what purpose. So for example, the project manager is using it for design of the project and also analysis. And some equity considerations for timeline and roles. By being clear about the timeline and roles, you can also be clear about opportunities and constraints. So like internal constraints. So if you know that you have limited availability to do data collection, choose a method that takes less time or work for you to conduct. And so just some final thoughts on data collection plans. We just want to reiterate that it's a dynamic roadmap for your evaluation and ongoing learning. So it's totally fine to update it. You should update it if your plans or priorities shift. Our Interact for Health friends have also shared with us, and they can chime in too if they'd like. But please reach out to them if you're struggling with developing a plan or if things are changing. They can help you think through it. You can get stuck sort of obsessing about getting everything perfect in a plan, but really it should just reflect your best thinking right now, which can change. And then second, try to focus your plan so you're getting the information you need right now to make decisions and communicate impact. And so, don't try and do everything because that'll just be frustrating and overwhelming, and nobody wants that. And then lastly, we think that a data collection plan, it's a helpful way just to be clear about all the components of your evaluation so everyone's on the same page. Being as clear as possible, hopefully is only going to be helpful. It may feel like you're going through a lot of different steps just to put everything in this template, but really being clear and laying it all out should only help you in the long run. And we have some resources. Again, don't worry about writing these down. We're going to share out the slides, but this is really just to say there's a lot of other information out there from other people as well that we find. These are just a couple of things that we find useful. Before we sort of do the indicators deep dive, we just wanted to pause and see if anyone either had any questions about data collection plan more broadly, or any reflections that are coming up for you, things you're thinking about differently now. And feel free to drop it in the chat or raise your hand, whatever you're comfortable with. Yes, Michelle, the world is very messy. So yes, everyone, please reach out to Interact for Health. Well, if there aren't any questions now, and I know some people need time to process, if questions come up as we continue through, drop them in the chat. But if not, I'll turn it over to Corey to do a deeper dive on indicators.
Cool. Thanks, Rebecca, for that overview of data collection plans. So now we're going to delve into one of the columns from the plan a little deeper, which is indicators. So let's just start right off by saying indicators are usually not the answer to your evaluation question in and of themselves, but they are a unit of information that allows you to measure and communicate about your work and help you track progress towards or achievement of a goal, right? So good indicators are ideally connected to your evaluation questions and desired outcomes. And like this can include also process outcomes, which Rebecca mentioned before, which are outcomes that tell you about the way in which the work was accomplished and not just about the results of the work. So indicators are really useful for a lot of stuff. Also want to just caveat, of course, some indicators just need to be tracked, not because they're particularly meaningful to you, or because they're of interest to you, but because they're part of a grant or funder requirement. And we just want to acknowledge that reality as well, that not all data collection that organizations do is necessarily super useful to them. We wish it was, and it's not always. So essentially, indicators can give you information about all phases of your project or initiative or intervention. So you can have indicators in the design phase. So you can ask yourself questions about like, who is involved and to what extent in the design process of a program or project. And so indicators could be associated with that type of question. You could have indicators at the implementation level. So like, was this program implemented with fidelity? How many people attended the meetings, trainings? Those are kind of indicators that live within that phase of a project. And then finally, you can also have indicators that track outcomes, and this is probably what you see most often in your work, right? So for example, you could have indicators that are associated with like, how did knowledge of an issue increase after a program? Like how many people continue to be involved in the work after an event, for example. And I think there's a reason a lot of indicators center around outcomes. It really talks about like the impact of your work. So like that's really useful when you're seeking funding, when you're trying to like communicate about what your organization is doing, right? But indicators can also be used in other phases and prior to that as well. So for the next few slides, what I'm going to do is I want to talk through some of the tools we find useful to kind of assess indicators and understand like whether they're telling us what we need to know or not. So that was kind of an overview of what an indicator is. Now, what actually makes a good indicator? So first and foremost, and I already mentioned it, a good indicator is really closely connected to your evaluation questions, your goals, and whatever you want to measure. A good indicator is also rooted in data that exists, are obtainable, and are credible. So a useful indicator is going to give you true, real, actionable information, right? That's going to be best practice. And then finally, and ideally, and this is not always, like people definitely track indicators that they don't have direct control over, but it is preferable that it's something that you or your organization have direct influence over. Because tracking something like that will make it easier for you to connect between like the activities that you're performing and then the outcomes that you're seeing, right? So just as an example, we used to work with an organization for that would track population data. And so they were looking at infant mortality in their region. And while their work definitely like probably contributes to like infant mortality going down, the relationship between their work and that number is a little harder to parse, right? Than if they were just tracking information more like at the level of people their programs actually interacted with, if that makes sense. And I see Kira, yes, you will have access to this PowerPoint later on. So no need to take extensive notes. Another way to assess the utility and quality of an indicator and these are like criteria we like to use, is looking at its communication power, proxy power, and data power. So communication power is essentially like how easy is this data to understand, and not just by yourself as program staff, but also by a diverse set of audiences. Proxy power is about meaning. So are these data meaningful? Is it telling us necessary and important information about the progress towards our goals or about our outcomes? And then finally, this was alluded to before, but data power is like, is my data actually reliable and consistent and accessible, right? So let's just go through an example because I learn best through examples anyway, so I hope you guys do too. So I made up an indicator. Let's say we are interested in tracking the percent of residents who attended an information session. So overall, I'll say like for comms power, I think it's pretty high. Like it's an easily understandable indicator. Like most people can understand if I say, hey, 40% of residents in a building or neighborhood attended an event. Like that's not too complicated. In terms of proxy power, though, I would say it is, you know, medium, maybe? Like, it's a pretty solid assumption that attending an information session imparts attendees with, like, certain information. However, like, attendance doesn't actually assess, like, the actual retention of information or the use of information, right? So in terms of communicating about the impacts of our work, this indicator is, like, maybe not as useful. And I gave it medium instead of low because obviously more people attending an information session is probably better than fewer, right? More people are being exposed to certain information. And then finally, on kind of the data power side, I think this indicator has pretty high data power. Maybe like I'm assuming we already have pretty good population data for like the neighborhood we're interested in. So if we just count who attends, we can easily figure out the percentage of people who attended. And oops. This is just like, also you could argue with me about the classification of any of these of this indicator along any of these dimensions, and you could still be right too. I will say this is, and I'll get into that a little more, this is more of an art rather and a tool for you to like talk through things rather than like a be all end all way of classifying indicators. Like there are many ways you could think through this, especially like, for example, if you are trying to communicate about something internally, like communications power, then it doesn't have to be easily understandable to like a diverse audience. It could just literally be understandable to you and like executive leadership, for example, and that would be enough. And so communication power would be high there. Context is like everything here as well. So I'm curious, what is one indicator you track? And if you don't mind sharing, like, how do you feel it measures up across some of these dimensions? And again, feel free to unmute and talk or just put it in the chat. Thanks, Rebecca. Yeah, and to make it easier, I'll also go back to this slide so you can actually see what I'm talking about in terms of the dimensions. Alicia, I see a question. I think I'll read it out loud, and Rebecca, then you can chime in and see if we can piece together an answer. So Alicia says, my organization has a mission to improve maternal health and reduce maternal mortality, specifically for Black mothers. We're currently conducting in-depth interviews with Black mothers with the intent of identifying where communication with their providers breaks down so we can develop a useful training for providers that improves patient-provider communication. So this instance, I can see our indicators including how Black mothers feel about their provider communication. We're still ultimately interested in improving maternal health. How could we track the data if not as an indicator? Do you have any thoughts, Rebecca?
I guess So if your organization has this mission of improving maternal health, like, have you defined as an org, or maybe there are like, I'm not a health expert, so maybe there are like external standards or definitions of like what it means to improve maternal health. So I think thinking through those, like the definition and like the different components of what improved maternal health looks like could then help you think about what you would want to track that would show maybe progress towards those different components.
Mhm. I'll add too that like indicators is truly just one way of like helping you. It's like just one component of answering your evaluation questions. Like it sounds, Alicia, like you're going to generate so much really rich data here from these interviews. And I assume like you'll be looking at them for themes. And that information is not an indicator, but it's going to be really important to like answering your question. So like the indicator, it has a very specific use case, right? It's an easily small digestible number usually that you can also like track over time. So it's convenient in that way. And it also doesn't tell you all these things that like would be contained within the information you're getting from the interviews. So I wouldn't get too hung up on like turning everything into indicators. I think it's totally fine to have this information that like will maybe reside as like a list of themes that are coming up that you can then revisit when you do another set of interviews like a year from now to see how things have improved or changed, right? I hope that
No,
answers your
that's
question.
helpful. Yeah, I unmuted really quick. No, that's really helpful because I'm trying to get I work with a lot of researchers on the academic side, but I'm also trying to think about as a nonprofit organization, not just getting stuck in the academic outcomes, which are useful, but also thinking about like what are other data that we can be looking at and paying attention to that don't just live within like academic paper land.
Right. Yeah, totally. Absolutely. And I think like with your interviews, like going through that and seeing like what mothers are talking about and what is important to them, like that will also give you things to start tracking, right? That maybe are not as present or missed in like validated tools or something like that, if that's what
Yeah.
you're referring to.
Yeah, that's a good point. Yeah, thank you.
Yeah. Any other questions or anyone else want to share about any indicators they track? No, that's okay.
I was just going to add to that. I think everything Corey and Rebecca said is spot on. But another like layer we sometimes think about at Interact is just like the multiple spheres of control. So like thinking about things we directly control, things we influence, and then things that happen that like maybe we play a tiny part in, but like are so much more broad than us. And the indicators within each of those spheres of control. And I've found that to also be helpful in thinking about like all of this within that and like what do we control, what do we influence, and then what kind of like happens out in the community context as well.
Yes. I love that. Thank you, Michelle. And then thank you, Heather, for your example. You shared that you track market vendor attendance and participation in training events, and you kind of like looked across the dimensions of how that indicator like fell across it. That's great. I love that. Thank you for sharing. Cool. Well, thank you. And I'll just say too, before I get onto this next section, like an indicator does not need to be strong against all, like across all these power criteria, right? And they often aren't. Sometimes like proxy power may be low, so like the meaningfulness of like the indicator might be kind of low, but maybe it's like the only reliable data you have, so you have to use it, right? Or maybe like the communication, the power is low itself, but like the indicator is really necessary to report on for funding or to fulfill a certain requirement. So like each indicator has its place and purpose, and they're not all going to be perfect. They all land really like on a spectrum. And some will really allow you to draw a straight line between activity and impact. And then some will just give you just enough information to get a sense of the direction your work is taking, right? More rigorous indicators like that first one are usually going to take more resources to track, which is also something to weigh when choosing indicators, right? Like ease is a very real criterion for evaluating whether you want to use an indicator. And I don't think we should feel bad about that, right? We are just human and we only have so much capacity to be able to like do all this work. And I know I'm mostly talking to people too who like evaluation is not your full-time job. And this is just another added layer to the work you're already doing. So ease is like so important. Saying this too, like I think a good indicator should fit into your workflow. So you can plan how to track it so that the data is available for important decision points that you know are coming up, for example, or like you can have access to this data when certain meetings are taking place, so you can like bring that there. I think that also is important to consider when you're thinking of what types of indicators to track. And I do think like you need indicators across this spectrum of power to track and understand your work. I think it's fine if you have indicators that are low across all of them. Though, of course, given some of these things we've talked about, I would love it if like you had a conversation about why it's being tracked, but usually like there's good reasons why you need this indicator. I think too, just one last thing is similar to data collection plans, indicators are not always fixed. So as you work and your understanding of your work changes over time, your indicators might too. I think there's a lot of power in having lots of good historical data on one indicator, but if it no longer closely aligns with your goals or any of the other criteria we outlined before, like it may be time for a change. Because like what I've seen often in some work is a tendency to like not want to like change the data being tracked because you have like these years of data that have been tracked previously, and so that you could like use that and see a trend. And if you change the indicator, then you would have to kind of start over. But if that historical data is no longer really fitting in with your work, is it actually worth tracking? I think is a good question to ask yourself. I think just like don't let your data collection be completely limited by what's been done before, essentially. Okay. Types of indicators. So after kind of like thinking through about some of the qualities of your indicator, we also use this tool that helps us think through the types of indicators that we're using in our work. And this matrix is used to classify and design indicators based on what they are measuring. So the matrix looks at indicators and how they measure effort and effect in both quantity and quality. And you'll see like the acronyms in each quadrant give examples of what indicators may measure if they fall within it. Just as a note, when we say effort, we mean the effort of like the organization generally, and focus on what the organization has done. So this is kind of implied in the questions, the top two quadrants, which focus on what we as an organization or initiative or group did. Effect, on the other hand, focuses on the change in participants of our program or intervention or work. So like, how are they better off? How might they have changed? I will say too, like, indicators don't have to just be about like individuals in a sense. Like it doesn't just have to be about the beneficiaries of a program or like an initiative. Like you could consider data that is also at the organizational systems or like community level. That's something to think about as well. So just to like give you a taste of some of the examples, if we're looking at effort and quantity, in this top left quadrant, how much should we do? So this is like maybe the most tangible quadrant, and it just really tells you like my organization did X activities and this is what came out of it. So for example, I just picked like number of pieces of research we put out. If we're looking at effort and quality, like this might be about the services that my organization provided and the satisfaction that clients are feeling. after having gone through these services. And then moving down, which I think the more interesting part of this matrix is effect and quantity. So that could be something like what percentage of households are covered by a service. And then when we're talking about effect and quality, like maybe we're thinking about what is the level of awareness of an issue among a group now? Like what change did my work cause for this group? And so generally, like, as I said before, the bottom portion is going to be more interesting and yield more powerful indicators for your communication because it talks about the effect you are having. So it's not to say that the top indicators aren't important because they are in many ways. Like, I think knowing how much research, for example, you're putting out is like pretty important, especially to compare year over year if that's like a goal of yours. But if you're communicating about your work, talking about the number of people trained may be less powerful than talking about what they got from the training. Not always, but like that's something to consider, right? So hopefully this tool can like kind of help you to maybe classify some of the indicators that you're already tracking and to understand where there's coverage and where there isn't. Like if all your indicators are kind of about effort, that's great. And what are some things that you can start tracking that can talk to the effect that your work is having as well? And I mean, similarly to what I was saying before, I think like a good data collection plan probably has indicators across all of these quadrants. I don't have a slide for this, but I'm just curious if anyone wants to share. Do the indicators you track tend to be focused on one quadrant, or is there a good spread just like within your own organization? I'm just curious. Carol, thank you. Indicators spread across the matrix. Excellent. Sounds like you have a good head start. Cool. Yeah, same spread out. Okay, awesome. Good. Well, I hope that this then gave you, you can give yourselves a pat on the back because you're already doing something really well. Awesome. Andy, I see yours are spread out to a degree. Cool. I think that's really interesting too. Like if I were you, I'd want to like classify them in each quadrant, see where I'm missing some. Cool. So the next big thing I want to talk about for indicators is benchmarking. So setting goals when picking your indicators is really important because most of our work is tied to change, right? Like change, comparison, like how are we doing year over year, or expectation. Like because I did this program, like I'm expecting X results, right? So all these usually require some level of baseline to be meaningful or make sense, right? So for example, using an indicator like I had before, the percent of households covered by a service. So a number alone here may be somewhat useful for your work, but if we had a target goal for percent of households covered, the number would also indicate how far we have like to go to reach our goal and if it's on time. So like having a baseline could also indicate like, should we pivot somehow in our strategy so that we can actually achieve our goal if we're not on track, for example. Another example could be like if I'm tracking level of trust in an institution. So like knowing that trust was high is useful, I guess. But I guess the question would then be like, was that expected? And like, has this changed over time? And if so, can this change be attributed to any changes we made along the way? Like there's a certain importance to like setting some sort of expectation for your indicator. And this is also to say, like in the beginning, you may not have a clear baseline because you just decided what you wanted to track, right? So like you don't have any data to compare it to. That's totally fine. And the first round of data collection is going to be establishing that baseline. So if you're collecting information how things are, continuing to collect data can help you know if you're moving towards how things should be, right? So this is all to say too, one thing I'm getting at is that like indicators and like the goals and questions they are tied to are like laden with assumptions. I think that's fair to say that assumptions just permeate all aspects of evaluative work. So if you take anything away from this today is that to always question what assumptions are underlying your work. So indicators themselves are laden with assumptions that the actions you're taking are going to result in a certain change, and that the change will look a certain way, and potentially on what timeline that change will take place. If there are no assumptions tied to your goals or like your indicators, then it feels a little more arbitrary, right? And it doesn't have as much of a reason to exist, but only for the sake of having it, right? So just as an example, to show you like some potential assumptions that could be underpinning any type of indicator, and also to show that like even the dumbest, simplest indicators like have assumptions tied to them. If I'm thinking about tracking number of training sessions offered, some assumptions that could underpin it are like more sessions are better because more people get the required knowledge. More sessions are better because it reflects demand of our training, or more sessions are better because it raises the profile of our organization. I think it's good to like know what assumptions you have going into this to really understand what your indicator is saying and what it's tracking over time. Cool. So when setting a benchmark, we already delved into like what assumptions are you making that are informing your goal and indicators. Another thing to ask yourself is what timeline do you expect to see change on? And finally, like what magnitude of change do you expect? So these will also help make your indicators as useful as possible. Like if you say, well, I want to see how much change happened over a month, great, but it turns out your organization does classes on a, I don't know, quarterly basis. So looking at change over a month does not necessarily make sense, right? You have to pick a time frame that makes sense for your work, and that will make your indicator more meaningful. Same for magnitude. Before we get to this question, I just want to say, like, obviously, like, none of this needs to be perfect or fixed. Which is also why asking yourself about the assumptions underpinning like these indicators and goals is super important. So like, while goals can be a tool for accountability, like don't let them become something you rigidly hold yourself to, essentially. They're something like I want you to feel like you can just learn from, like they're just a tool to help you learn. Like, are we on or off track? Like, what does it mean if we're one or the other? What may we need to change in our work, or like how we're measuring something, depending on what the indicator is telling us. So again, I have a question for you. What is one benchmark or goal that you have in your work? And if you want to share, like, what are some of the assumptions that underpin it? And maybe if you don't have a benchmark to share, like, have you encountered any challenges in trying to try to like set goals? What have those looked like?
I was gonna, is it okay if I come off mute? I don't know.
Please.
Hi, okay, this is Sierra. So I think mine is a mix of a question to get your feedback.
Mhm.
So I guess I'm looking at impact, right? And I
Mhm.
think when you're looking at impact, that's very, it's like, it's in the clouds. It's like impact. What does that really mean? How do you
Mhm.
measure impact? So one of the things that I know for me that I'm struggling with is one, like sample size, like how many people do I talk to show that this is impactful, like this action or this program that I'm
Mhm.
trying to do is impactful. Um, and to even get to benchmark or to like even set to say, oh, this program is impactful, and I kind of struggle with one because you have to engage people, you have to get people to see your work, and then from there you transition to, okay, let me measure how they feel and try to turn that
Mhm.
into some sort of um, quantitative data that shows, X amount percent of people like this. But I guess one of my questions, and maybe to share your thoughts on, is how do you kind of create that sample size? Like, is that just something, it's like if I could hit 100 people, I would be
Mhm.
happy? Or is it, there's some sort of method to kind of figure that out? Because, if I talk to 6 people and I say I have 100% succession rate, you're like, you only talk to 6 people. That's not, like, is that truly valuable information?
Mhm.
So I guess that's for me, like where I struggle with, because I can make a goal and I can say, hey, I just want to know, if I can fit 10 people in here and get 10 people to sign up, then to me that's great. But if I look at, is that impactful or not, I guess I can base off those 10 people, but I want to look at long term. So it's
Mhm.
like, do I try to aim for a bigger number? Like, when do I stop? I don't know. Does that make sense?
Yeah, I think it does. And you're not gonna like my answer, but I feel like it is more of an art than a science. So like I wouldn't say
Mm,
I have any particular method to like set a goal that um that objectively like
mhm,
lands right. Like there's no objectivity here. I think what you said is I heard like what can I be happy with? And depending on like the program you're running, like maybe that's enough to start with. Like if I can get 10 people in here, great. And maybe you don't start tracking anything until you have like, I don't know, your first program and see how many people actually go through it. So then your goal becomes, well, if I can like meet or exceed this for my second program, like that's good enough.
mm,
Um, for sample size, I think I struggle with that too, because like when we work, we often are not working with like big samples. Like when we're talking to people, we're maybe talking like 10, 15 people. And my answer to that is, and I'm gonna butcher it, but Heather Kraus, who does We All Count trainings, had something to say about that, which is it's not about the like actual size of the group that you're talking to. Um, it's about like, are they the right people? So
mm,
if you're talking to 6 people, but all the people who went through your program total 6, sounds like you're talking to the right people. And so that's the sample you kind of have, right?
right.
Um, so I guess what I'm trying to say too is like don't get locked into like feeling like you need increasingly like impressive numbers because I think that will mostly impede you when if you don't reach them, right? I think
Hmm.
it's about like something reasonable that's based on your best guess and it can change.
Okay. No,
Um,
that's very helpful. That was very helpful. So you did
Rebecca, I
help
don't.
me.
Rebecca, would you add anything?
No, I like your answer a lot. I guess the only thing is, yeah, like are you feeling pressure to quantify things? We're very much team qualitative. And like the rich data that you can get from like conversations with, 5 people, like um can provide like a lot more nuanced information than trying to like slot something into an in like a quantitative metric. But like we understand that there can be pressure from maybe like leadership or board or funders who may like come from different backgrounds and may just prefer to see numbers. So it's not really an answer just to say like the struggle is real. It's a hard thing to deal with and to sort of like not like justify, but like show the like richness of the qualitative data.
Yeah. Like we used to work with a client who each program of theirs got 1 page and like 2 graphs to explain the entirety of their work to the board. And so like so much is lost there, and yet that's kind of like what they had to deal with. So yeah, it's a constant struggle.
No, I appreciate that. No, it definitely makes a lot of sense. And I do like qualitative data too. I don't want to just focus on the numbers, the numbers, the numbers, because it feels robotic, especially when you're trying to, show growth and change in things. So I agree with both. I was just curious to
Yeah.
hear that. But I appreciate both of your responses. Thank you.
Yeah. I also see Marianne has a question about equity considerations when you're setting goals. And is it like, how do you make sure to have an equitable lens and when you're making assumptions about like what a good goal is? My answer would be, who is most affected by this goal, I guess? Like, who are we talking about? And then getting them in the room and seeing like if what you're setting makes sense to them, and using their own lived experience. Like, does it seem realistic? I feel like the answer to addressing a lot of these equity questions is often going to be like, how do we get people who are like, just to take a program, like the beneficiaries of a program, how do we center their voices in this? And it might be engaging a little deeper with them. Yeah, awesome. Good questions. Love it. And we will get into some equity assumptions here too. Actually, right now. So when creating indicators and like whatever goals you have with them, whatever benchmarks, you're going to need to ask yourself who the indicator is meaningful for, and who is defining what is being tracked or establishing what success may look like. So I hope this is going to get exactly to your question, Marianne, and then Alicia too. Where was I? So yeah, you have to ask yourself who this indicator is for, who is it meaningful to, and who's determining what success looks like, right? So I think that goes directly to your question, Marianne, like if it is the executive director who's paid $150,000 a year to like set a goal for a population who lives under the federal poverty limit, for example, like what potentially could that lens be missing, right? So you want to ask yourself, like, who is setting the standards for success as well? And if it's not someone who's like most directly affected by this certain indicator, like maybe then that's something to think about, and thinking about how you can include their voices and knowledge in your evaluation tracking. So one exercise to help with this is the following, and this is based on, thank you, Rebecca, for putting the link in the chat, Heather Kraus, who is really great. And this is something that we often think about in a lot of our projects. So this exercise is going to allow us to like try to consider the perspective of multiple groups as we're thinking through like what an indicator means and like what a goal means. So here's some example indicators for a project. So I have % of students receiving adequate financial aid for post-secondary education. And then I also have a number of students of diverse backgrounds enrolled in the program. So what I want to do here is think through. So if you were able to have a highlighter and highlight every word that you wanted to, what words would you highlight here for words that could hold multiple definitions to different groups, if that makes sense? So like looking at these indicators and you're reading through, what words do you think could be interpreted differently by different groups? And you can just toss them in the chat. Financial aid, adequate, yes. Like, what does adequate even mean? Yep. Diverse, yep. I did that one on purpose to bait you guys. Diverse means nothing here. Yes, awesome. And in fact, as it turns out, I could pretty much underline almost every noun because I think there's an argument to be made that like almost every one of these words can be interpreted differently. Like even the word student, maybe my organization only cares about full-time students under the age of 35. I'm being super specific. But the other people consider themselves students, don't they? Like if they're going part-time because they have to work. If they're a non-traditional student who's like over 35, you know, like these are all up for debate, I would argue. So what you do here now is you think about who's going to be affected by how we would define some of these terms. So like depending on how I define student or diverse background, like who's going to be affected by how I'm doing that? Probably students is one group. Anyone else? That's okay. I'll give you guys. Yes, the person enrolling the students, totally. I can give you guys the answers, don't worry. So this is just an example, me quickly running through and like thinking through some of the things that different groups might value. So Kira, yes, the program director, the grant writers, yes, these are all people who are going to be affected by this. So one thing to do here as an exercise is to like think through all the people who'd be affected by how you define something, and then see how they define some of these terms, right? So for example, here in my invented program staff think that only first-time students in four-year colleges count as students for the purposes of their program. But if you have students like any age in any formal education program at any level counts. If we're thinking about adequate financial aid, students might define them like, I don't actually need to have, I don't need loans. I may need to work on the side, but I don't have to take out loans. For program staff, maybe they're like, you need to take out 10K or less, and that's good enough, right? Same thing for diverse, like program staff might be thinking of any marginalized social identity, but then thinking also of like who else is working in this space to support students. Like maybe diverse actually like in the wider ecosystem means mostly low income folks and then BIPOC groups, for example. And then maybe like for funders, they're really only concerned with low income people. So that's really going to affect like what your indicator is tracking and like how you define what you're tracking, right? So this is like a nice exercise that we often use, like if you think of a beginning of a project, or like when you're just starting to define certain terms, like get a common language, like this is great. And I can't take credit for it, unfortunately. Heather Kraus all the way. So just some final thoughts for these indicators. Just to summarize some of these key points that we want you to take away. Indicators can really help you communicate about your work and progress towards your goals. Of course, they're not the only information that you have to play with. There's plenty of other stuff that's like qualitative and rich and doesn't fit as an indicator that you're going to be tracking. no indicator is perfect. You're gonna have to make some trade-offs and compromises when you're selecting what you want to track. I think the important thing here is just to make sure you know why you're making the choices you are making. And you are also thinking about who is defining what counts. So no indicator is perfect, but you need to think about why you're making the choices you're making. And then finally, like an indicator without a benchmark is less useful. Again, be intentional about thinking through what you expect, what your goals are in tracking an indicator, and like what timeline you could expect change on. And then finally, there are some more resources. There's so much more out there. I just picked our top 3. And don't worry, you will get these slides, so you don't have to do anything with this. And then I just want to end with thank you all for being here. But then we also wanted to open up the floor to any more questions or any other discussions that you guys want to have.
And also, Rachel dropped a link to a survey because we all like data. There's a very short survey. It would be great if you all could fill it out.
So now's the time. If you have any other questions or like reflections, we'd love to hear them. And if you don't, that's okay too. We won't take it personal.
I was just gonna say this is really good information. I think I like processes. I think you can sit and just, I mean, it's okay to write stuff down, just, throw stuff out there, but I do like tools and different like methods that you can use to kind of sort through your thoughts. So this actually helped me a lot to just learn about the different tools and methods to help sort through all of this. So I appreciate it.
Yeah, thank you. And we're glad that this was useful. You would love working on our team because we're all about process, to the point where some of our clients get mad at us for taking too much time on process.
Yeah, I'm all about process. Sorry, just kidding.
Course too, like if you guys have any other questions as well, like we will share our emails, and like please feel free to like reach out to us. And of course, Michelle from Interact for Health is always there to also like help you and her team. I don't know, Rebecca, you ready to close this out?
Yeah, we just have a few like parting thoughts. Wrap up. We just like hopefully you take more than a couple things away today, but we really hope if you take like a few things away, it's like the importance of making your data collection plans and your indicators intentional, realistic, and dynamic. So really just wanting to reiterate that, like, as we have all learned recently, like context changes really fast. Things can change really fast in the work that you're doing, and like you're going to need to adapt. You're going to need to change your plans. You're going to be busy, like things are going to come up. So you also want to be really realistic. And you want to make sure that like you're gathering information that's going to help you make decisions. And so you want to be really intentional about what you're doing. And so those are sort of like top thoughts, and just something for you to think about as you're signing off, about like what one action you can take right away to start a data collection plan, start developing indicators, or because a lot of you said you already have data collection plans and indicators, like what is something you can do to improve or think differently about your data collection plan or indicators. And feel free to either just think it in your head or drop it in the chat if you want to share with others. And then, yeah, just feel free to reach out if you have any questions. Feel free to reach out to your Interact for Health staff. We will share slides and a recording as well. And thank you, everyone.
And thank you, Corey and Rebecca, so much. That was so awesome, super helpful. Yeah, and like Corey and Rebecca said, if there's anything that Interact for Health can do, or Innovation Network, let us know, please. We're there to help. So feel free to reach out, and thanks, everyone.